Occupational English test. Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Hi there. What seems to be the problem?
Lately, I've been experiencing pain around my elbow, especially when I grip or lift things. It's been quite bothersome.
I'm sorry to hear that. Can you describe the pain to me? Is it sharp, dull, burning?
It feels more like a dull ache, but can get sharp when I do certain movements. The pain intensifies when I'm trying to open jars or even just grip my water bottle tightly.
How long have you been experiencing this?
It's been about a month, but it seems to be getting worse with each passing week.
Have you had any recent injuries to that arm or engaged in repetitive activities that involve your forearm?
I haven't had any direct injuries, but I've started playing tennis more frequently over the past 2 months. Could that be related?
It's possible. Tennis can sometimes be a contributing factor to certain types of tendinitis. When you play, how often and how long do you typically play?
I've been playing about 3 times a week for around 2 hours each session.
Okay, that's good to know. Do you experience the pain during or after playing?
I feel it more after playing, especially the next day. But lately, I've started to feel a twinge even while I'm on the court.
Got it. Are there any other activities or movements that seem to aggravate it?
Actually, yes. Simple tasks like typing on my laptop or even carrying grocery bags seem to make it hurt more.
Understandable. Have you tried any treatments or interventions so far to help alleviate the pain?
I've been using an over-the-counter pain relief cream and sometimes an ice pack after playing tennis. But it provides only temporary relief.
And in terms of any previous medical history or conditions related to your arm, elbow, or joints, is there anything you think I should know about?
Not that I can think of. I've never had any significant injuries or surgeries in that area.
Based on what you've described, it sounds like it could be a form of tendinitis, possibly tennis elbow, given its association with your recent tennis activity. However, a thorough examination would be necessary to confirm this. Have you considered seeing a physical therapist or a sports medicine doctor?
No, I haven't. But if it's related to tennis, that makes a lot of sense. What do you recommend as the next steps?
I'd recommend seeing a specialist to confirm the diagnosis and get a tailored treatment plan. They might recommend exercises, therapy, or even certain braces to help. In the meantime, consider reducing or modifying your tennis activity and continue with the ice and pain relief measures.
Thank you for the advice. I'll look into scheduling an appointment. I really want to get back to playing without any pain.
Absolutely. I hope you find relief soon. Remember to listen to your body and give it the necessary time to heal.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning. How can I assist you today?
Good morning, doctor. Lately, I've been feeling really groggy during the day, and my husband says that I snore loudly and sometimes even stop breathing in the middle of the night.
How long have you noticed these symptoms?
I think the fatigue has been for the past few months, but the snoring and breathing issues, according to my husband, started around a year ago.
That's concerning. Do you wake up with a dry mouth or a headache in the morning?
Yes, quite frequently actually. And sometimes I feel short of breath as soon as I wake up.
Have you ever fallen asleep during daytime activities or while driving?
A few times, yes. Especially during the afternoon, I get overwhelmingly sleepy.
Do you know if anyone in your family has had sleep apnea?
I think my father had it. He used to snore very loudly too.
Are you currently on any medications or have any pre-existing conditions?
I am on medication for high blood pressure and I'm also overweight.
Sleep apnea is a serious condition where breathing stops and starts during sleep. The symptoms you're describing are consistent with this condition. Do you consume alcohol or smoke?
I have a glass of wine occasionally, and I don't smoke.
Alcohol can relax the throat muscles, which can worsen sleep apnea. Even occasional drinking can have that effect. Being overweight can also contribute to sleep apnea. We may need to get a sleep study done to confirm this diagnosis. Would you be open to that?
Yes, doctor. I just want to get to the root of the issue. I'm worried about my health.
I appreciate your concern and willingness. A sleep study, or polysomnography, is done overnight and it will monitor various body functions during sleep, including brain electrical activity, eye movement, muscle activity, heart rate, and more.
That sounds comprehensive. What can I do in the meantime to manage my symptoms?
Elevating the head of your bed, sleeping on your side, avoiding alcohol, and using a saline nasal spray to keep your nasal passages open can be helpful. However, if the diagnosis confirms sleep apnea, more specific treatments like a CPAP machine or even lifestyle changes might be recommended.
Is sleep apnea treatable?
Absolutely. Depending on the severity, treatments range from lifestyle changes like weight loss or positional therapy to devices that help keep your airway open, or even surgery in severe cases. The key is to get diagnosed early and start on an appropriate treatment plan.
Thank you, doctor. I'll await the sleep study and your recommendations after.
You're taking the right step forward. Remember, sleep apnea can be managed effectively, and addressing it can significantly improve your quality of life. We'll be with you every step of the way.
I appreciate your help and guidance. That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Have you noticed any other symptoms besides the weight loss? Perhaps fatigue or a change in appetite?
Yes, I feel tired all the time, even after a full night's sleep. And I just don't feel like eating much these days.
And when did you first start noticing these changes?
Around 3 months back. At first, I thought it was stress, but then the weight loss became quite significant.
All right. I'd like to run a series of tests to rule out any malignancies. Did they ever conduct an endoscopy or a colonoscopy on you?
No, I haven't had either.
Let's schedule both. It's essential to get a comprehensive view, especially with these symptoms. Don't worry, we're here to help.
Now look at question 26. This is Mrs. Patterson. She had a severe asthma attack at home and was using her inhaler multiple times without relief.
Got it. How's her oxygen saturation and lung sounds?
When we arrived, her O2 sats were at 88%. We've given her nebulized albuterol, which helped increase it to 94%. But her lung sounds are still diminished, especially in the lower lobes.
All right, let's get her on continuous nebulization and monitor her CO2 levels. Do we know if she's allergic to anything?
She mentioned she's allergic to aspirin. She's also on a maintenance dose of corticosteroids for her asthma.
Okay, we might need to consider giving her a dose of 4 corticosteroids to combat this flare-up. Let's keep a close eye on her and make her comfortable.
Now look at question 27.
This patient came in with acute chest pain last night, right around midnight. What was the EKG result?
It showed ST elevations in the anterior leads. Classic signs of an anterior wall MI.
Have we started him on any thrombolytics, or was the cath lab prepped?
He went straight to the cath lab. They did an angioplasty and placed a stent in the left anterior descending artery.
That's quite crucial. And his troponin levels?
Elevated, as expected. But they should start trending down now.
Let's keep a close watch on his vitals and cardiac enzymes for the next 48 hours. And make sure he's on a beta blocker and statin regimen.
Will do.
Now look at question 28.
I just reviewed the patient's lab results. It seems like her TSH levels are through the roof. Did we get any free T4 values?
Yes, the free T4 is quite low. Looks like primary hypothyroidism to me.
I agree. Has she been complaining of any fatigue, weight gain, or feeling cold?
She mentioned all of those symptoms during the initial consultation. And her skin is quite dry as well.
All right, we should start her on levothyroxine. Monitor her symptoms and we'll adjust the dose as needed based on her TSH and T4 levels in a few weeks.
Understood. I'll also advise her on the importance of medication adherence and regular follow-ups. Now look at question 29.
Good afternoon, everyone. Welcome to the Effective Medication Management Workshop. I'm Dr. Neil Thompson, and I'm in charge of the hospital's pharmacy department. This program isn't about merely dispensing and administering drugs. It's about a comprehensive approach to ensuring patient safety, effective drug use, and managing drug interactions. With an increasing number of polypharmacy patients, understanding how medications interact is crucial. You're not just ensuring the right dosage, you're ensuring that the patient's entire drug regimen is synergistic, not antagonistic. This workshop will enable you to confidently assess a patient's entire drug profile, recognize potential problems, and make appropriate adjustments or referrals. Let's work towards improving patient outcomes and minimizing adverse reactions.
Now look at question 30. All right, team, focus up. We've got a young patient, around 6 years old, with a suspected ingestion of household cleaners. His respiratory rate is elevated, and he's presenting with burns around his mouth. I need someone to prepare activated charcoal and start in 4-line. Let's also get a blood gas done immediately. I'm concerned about possible damage to the esophagus and stomach. Contact GI for an endoscopy consult. And please, someone contact the parents. They need to be informed and will likely have valuable information about the ingested substance. We need to act quickly, but carefully. Everyone clear on their roles? That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Good afternoon, everyone. I'm Dr. Emily Donovan, a rheumatologist and an expert in inflammatory diseases. Today, I'll delve into the intricate world of vasculitis, the inflammation of blood vessels, and the current challenges and advances in managing this condition. For those unfamiliar, vasculitis represents a heterogeneous group of diseases characterized by inflammation of blood vessels, causing a myriad of complications depending on the affected organs. But why should we be concerned? Just like the issues with antibiotics, if vasculitis goes unchecked, it can lead to irreversible organ damage, or worse, be fatal. From 2000 to 2015, there was a notable increase in vasculitis diagnosis worldwide. As diagnostic tools improved and awareness grew, more cases were identified. Despite this rise, we face challenges, especially in timely diagnosis. Often, vasculitis mimics common conditions, making its identification a daunting task for many physicians. Furthermore, while the medical community is becoming more aware, there is still a considerable delay in specialized treatment in many parts of the world. Interestingly, recent studies have pointed towards environmental triggers for certain vasculitides, especially those affecting the larger vessels. Just as with the antibiotics crisis, there's a clear human component. From certain infections to drug-induced reactions, the triggers are diverse and often modifiable. Positive strides are evident, however. Data from the past 5 years show better outcomes for patients with ANC-associated vasculitis, largely due to more refined treatment strategies. A prime example is the shift from broad-spectrum immunosuppressants to targeted therapies, limiting the side effects while improving disease control. This mirrors the move from broad to narrow-spectrum antibiotics. But challenges persist. The news recently highlighted a controversial study suggesting that low-dose immunosuppression might be equally effective in certain vasculitides. While promising, it's essential to approach with caution. Lowering doses may reduce side effects, but the risk of flare-ups increases, potentially harming vital organs like the kidneys. However, the good news doesn't stop there. In the realm of giant cell arteritis, an advanced imaging technique called PET scans is showing great promise in early detection and assessment of disease activity. The importance? Early treatment can prevent the devastating complication of blindness associated with this vasculitis subtype. Then there's the issue of vasculitis in our daily environment. Many aren't aware that certain medications, from blood pressure pills to antibiotics, can induce vasculitis. While rare, it's a stark reminder of the delicate balance in medical therapy, the same way antibiotics can sometimes do more harm than good. So, what's on the horizon? Excitingly, research into biologic agents, specifically designed to target the immune system's inflammatory components, is gaining traction. Just as the pharmaceutical industry is buzzing about phage therapy for bacterial infections, the rheumatology world is abuzz with monoclonal antibodies for vasculitis. In conclusion, vasculitis is a complex, multifaceted disease that poses significant challenges but also offers exciting research opportunities. As with antibiotic resistance, it's a call to action for the medical community to continue refining our approach, ensuring every patient gets the best shot at a healthy life.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Today I'm speaking with Dr. Alice Monroe, a leading neurosurgeon specializing in meningioma surgeries. Dr. Monroe, could you first explain to our listeners what a meningioma is?
Certainly. A meningioma is a type of tumor that arises from the meninges, which are the layers of tissue that cover the brain and spinal cord. Most meningiomas are benign, which means they're non-cancerous. However, they can still cause problems because of their location and pressure they might exert on surrounding brain structures. It's one of the more common types of brain tumors, but the causes are still being researched.
That sounds concerning. How do people usually find out they have a meningioma?
Many people with meningiomas don't have symptoms until the tumor becomes quite large. Others might experience symptoms like headaches, changes in vision, seizures, or even memory lapses, depending on where the tumor is located. Meningiomas are often discovered incidentally during brain scans for other reasons.
What's the typical approach to treating a meningioma?
Treatment depends on several factors like the size, location, and growth rate of the tumor, as well as the patient's overall health. For smaller, non-threatening meningiomas, we might just monitor them with regular imaging tests. If the meningioma poses a threat or causes symptoms, surgery might be necessary to remove it. In cases where surgery isn't feasible, radiation therapy might be recommended.
Sounds like a complex process. What sort of background or training do you need to tackle these surgeries?
Becoming a neurosurgeon requires many years of training. After medical school, one has to complete a neurosurgical residency, which takes about 7 years. During this time, surgeons gain expertise in various brain and spinal surgeries. Meningioma surgeries, given their complexities, require a lot of precision and understanding of the brain's intricate anatomy. Many neurosurgeons, including myself, further specialize with fellowships in skull-base surgery or tumor surgery to gain even deeper expertise.
And how crucial is the team dynamic in the operating room during these surgeries?
Absolutely essential. A meningioma surgery isn't just the work of the neurosurgeon. We rely on a team that includes anesthesiologists, radiologists, neurologists, and specialized nursing staff. The coordination and expertise of the entire team play a vital role in ensuring the patient's safety and the success of the procedure.
How do you manage the emotional aspect, especially given the anxiety patients might feel knowing they have a brain tumor?
Communication is key. Patients and their families have a lot of questions and concerns. It's essential to take the time to discuss the diagnosis, the procedure, risks, and postoperative care. Being transparent and compassionate helps in building trust. Furthermore, postoperative counseling and support groups can be beneficial for patients adjusting after the surgery.
Thanks, Dr. Monroe. Your insights into meningiomas have been enlightening.
I'm glad to share. It's important that people are informed and understand the complexities of such medical conditions.